complications of axial SPA. So within the spine, with long-standing disease and spinal deformity or long-standing involvement of the spine, predispose a person to spinal fracture. And because of the changes of the vertebrae, it may cause compression on either the spinal cord or the nerves around the spine. Outside of the spine, axial SPA may also rarely cause problems with the heart valve, in this case the aortic valve, leading to this heart condition called aortic regurgitation. And also rarely it can result in lung disease, either what we call a restrictive lung disease. Because of the changes of the spine, change of the curvature of the spine, the lungs become what we call like compressed, so they have this thing called the restrictive lung disease. And rarely another lung condition known as lung fibrosis, which is inflammation of the lungs, may occur, typically in the top part of the lungs. And another complication that may occur from long-standing and uncontrolled inflammation is also cardiovascular disease, where they can develop more atherosclerosis, heart attack, and strokes. But with the advent of better treatment and control of the underlying inflammation, and also control of other risk factors such as high cholesterol, high blood pressure, and smoking, the complication of this may be minimized. So in terms of diagnosis, there's no one single direct test to diagnose axial SPA. Diagnosis by a doctor is based upon a combination of history with the typical symptoms of the inflammatory back pain, taking into account the age of the patient, whether there's any positive family history. Physical examination is also key to look for any signs that may suggest inflammation in the sacroiliac joints, or whether there's any spinal deformity and limitation of the spinal movement. Blood tests is also important. A doctor may take blood tests for inflammatory markers, which include the ESR, CRP, and also check for this gene, the HLA-B27. And imaging is also important, X-rays or MRI of the spine or sacroiliac joints. And if there are other joints on the arms or legs that are affected, such as the Achilles tendon in the heel, sometimes an ultrasound may also be useful to look for any underlying inflammation in that joint. So in some cases, especially in patients with no X-ray changes, observations and repeated consultations with a doctor for a number of months may be necessary before a diagnosis can be definitively made or confirmed. So like in non-radiographic axial SPA, where blood tests and imaging may be normal, even though the person may have symptoms. And evaluation of associated conditions such as the eye inflammation, bowel inflammation, and psoriasis may also require referral to other specialties such as the eye, ophthalmology department, the gastroenterologist, or the dermatologist to manage. So the same treatments are effective in both ankylosing spondylitis AS and non-radiographic axial spondyloarthritis. So this includes medication, exercise, and smoking cessation. So for exercise, usually a range of motion and stretching exercises is recommended, as well as some aerobic cardiovascular exercise, strengthening exercise, and balance training. Posture training is also important. This is especially relevant in people who already may develop spinal deformity and fusion of the spine and the stoop posture, because posture training will at least help the spine to fuse in the least severe way. And you may be also referred to physiotherapists for exercises and to be educated on what kind of exercises is appropriate. It's also important to have adequate rest, a healthy balanced diet, sufficient calcium and vitamin intake to optimize bone health, and to stop smoking, as smoking may worsen the arthritis condition. and the spondyloarthritis.